Welcome to another episode of Drunken Medicine, where we are drunk on medicine and we're passionate about whiskey. My name is Mike, and I didn't mess it up. Yes.
Good job, Mike.
My name is Mike. I've been an acupuncturist for, I keep saying 13 years, but now it's about to be 14 years. And I've treated a ridiculous amount of things over those years. And so we love talking about whiskey and we love talking about different conditions and different things that we treat in our prospective practices and over the years. And this is Dr. May. Ash, tell them about yourself.
Hi. So I'm a naturopathic physician. Again, we've been practicing about the same time. So 13, going on 14 years. At this point, I do feel like I've kind of seen a little bit of everything, like you said. And I've treated just about everything. At this point in my career, though, I am board certified in endocrinology, so I do tend to see a lot more endocrine disorders, hypothyroid, menopause, low testosterone men, those kind of various things. Getting in more to injection therapies now. So I do a lot of prolozone, PRP type injections into joints, tendons, all those sorts of things now too. So that's me.
When you said bored, you had a pause there, and I thought you were just going to say you were bored. And being a practitioner, I'm glad you're board certified.
I'm certifiable too, and I'm rarely bored. So
rarely bored. That's good.
Rarely bored. Yeah.
And you're not now because you're drinking whiskey. I think. What are you drinking?
That's right, man. I am still working on this Glacier Distillery, the local one's called Belton Bridge. It's really good. I mean, I'm just kind of taking it slow with it. It's great to continue to drink neat. What are you drinking today?
That's pretty neat.
It's pretty neat.
Oh.
Neato.
So I have another Talisker today. This is Talisker Storm. Really, really good. So it's another Islay Scotch on the ocean by the sea. And it's wonderful. I love everything by this distillery. They put almost everything at 45.8%, which is great because that's the percentage where their stuff's really good. I love it sounds like a romance novel almost though. Powerful and smoky, brooding spice.
Brooding.
It's great. Brooding. Anyways, it tastes like a Scotch to me, but it's got that nice smoky, salty that I like. This one is not in a sherry cask, so it's less sweet. It's more peaty, more medicine-y.
More peaty. I was going to say on the peaty scale, like how bad is it?
That's about an 8 out of 10.
Oh,
and my 10 is like turn your face. So.
Oh yeah, I don't think I'm going to be trying that one.
It's like smoke and spice and a little bit of oak with like this saltwater splash in the background from the sea.
Oh, sorry, you didn't convince me on that one.
You have to. It's so good. You have to try it. Next time we get together, you can try it. It'll be good.
All right. Well, maybe. All right.
We'll wait.
Moving on. All right. So today is going to be an AMA, sort of Ask Me Anything, and just a little different than the other ones where we were talking about subject matter, like one specific subject and kind of our different perspectives and ways that we treat those various things. So today we're gonna jump around and talk about a lot of different things. So Mike, before we do that, we have had some questions about what is it exactly you guys do? Like, what are you? I've never heard of this naturopathic doctor kind of stuff, and in acupuncturists, like what do they do, like with the whole needles and Chinese medicine thing? So I think we could probably clarify a few things of just who we are, like what we do, like what's our training, that sort of thing. And then we can jump into some of these questions. So Mike, once you get us started, man, what is it about, what is it that acupuncturists do? What kind of training do you have? I mean, did you get this on an online degree and just start poking needles in people, the next day, or like?
Absolutely not. So most acupuncture schools, you actually have to have a bachelor's degree even before you go in. So some will allow you to get your bachelor's or finish your bachelor's while you're there, but most of them, they want you to have it before you come. So you already have a degree of some type beforehand. Whether I have a psychology degree, it could be pre-med, it could be a lot of different things. Biology is a good one. And then the actual graduate program is somewhere between, I would say 3 to 4 years, but 3.5 to 4 is more realistic. And it's only a master degree, but it's a lot of hours. It's about 70 credits short of a PhD. So it's a significant amount of hours.
Wow. Yeah.
I had 19 graduate credit hours my first term, which is insane. It's a lot.
Mm-hmm. Yep. Yeah. I know that they don't realize, like, people don't realize like how much didactic work goes into those graduate programs like acupuncture. So that's
Yeah,
a ton of classes, man. I mean, I
it
remember,
is.
like, you think when you go through undergrad, if you're taking like 18 credit hours, that's like max, right? Like that's a full load, like can't fit anything else. Dude, it wasn't like unusual to do 19 to 23 credits a quarter, you know. Um, so
Yeah, exactly. And so 3.5 years, and you get a graduate degree. You also get your certification because you get board certified to be able to get a license according to what state you're in. So you get a board certification that has standardized testing that you have to do. So it's not just here, we're going to give you your license, go practice. You have to pass standardized tests that are agreed upon across the country as being like, this is the standard to show you actually know what you're talking about.
oh,
Um,
cool.
and that's actually a really tricky part right now because some other professions are able to piggyback into acupuncture without the training. So in some states, PTs can do practice dry needling, but practice it as acupuncture with a 20-hour weekend course. So I did three
That's
and a half
crazy.
years. They can do a 20-hour course and start stabbing you deep with needles. It's
Yeah.
nuts. It's nuts.
Yeah. I mean, I get that they have a wealth of like anatomical knowledge,
Yeah.
but I mean, it's different than knowing how to use needles in the system and using that. And it's, yeah, I get it.
Yeah. And you don't want a pneumothorax. That's no fun.
It's funny. Like, we had a couple of PTs in Fairbanks when they first started being able to do that. We had two pneumothoraxes like in the first 6 months, after they were qualified, to do that. But
And you know what I
um,
heard when that happened? Acupuncture did it. That's the first thing I heard that week is acupuncture
yeah,
did it.
that figures. So what,
Anyway,
as
so
far
that's
as clinical stuff goes, like as for with your training, I mean, do you get a lot of exposure to patients and like, working on them before you're actually out and on your own putting needles in
you do.
people?
You do. So you start on inanimate objects, which is funny enough. You start practicing on like tissues, like packs of tissues and like oranges and grapefruit.
Hmm.
Um, and then you work on other classmates because you're gonna hurt at the beginning. So you
Yeah,
work on classmates so you hurt each other and not the public.
yeah,
And then you do a ton of clinical experience in the clinic where you're seeing actual patients with a supervisor that's making sure that you're doing everything correctly. You don't have questions, no one gets hurt, that sort of thing. And I think we did that for over a year and a half. I mean, a significant amount of time before you actually go out and are trusted to know what you're doing. So,
hmm. Okay, all right.
how about you?
So
Like, tell me about your training.
Yeah, so it's very similar, especially the first 2 years didactically with MDs and DOs. Actually, a lot of the professors we had that taught our didactics taught at the University of Washington Medical School too. So like, there's just a ton of crossover. It's the same material. We're learning pharmacology, all the anatomy, chemistry, biology, physiology type stuff. We have a gross dissection, so we work on cadavers. We're dissecting cadavers the first year as well. So it's a ton. We actually have more didactic hours in the first 2 years than MDs and DOs because we learn all of that. Plus, we also get into botanical medicines and physical medicine type stuff. Spinal adjustments, extremity adjustments, things like that as well.
Hmm.
So it's a ton. Like, it wasn't anything to have 20, 25 credit hours per quarter. And just it was a ton of coursework. Now the clinical aspects are different. That's where the divergence is somewhat significant because we're trained as primary care providers, not hospitalists. So we're not going to be surgeons. We're not going to be out there in the hospitals, doing rounds and treating, severe acute illnesses. So we do 2 to 3 years of clinical rotations, but they're usually in a primary care setting.
Yeah.
So we're dealing with everything from like the sniffles to autoimmune conditions and hormonal issues and all that kind of stuff in between. Everybody from
Nice.
pediatrics to geriatrics. So it's a pretty well-rounded experience. I really enjoyed it. You get out feeling pretty confident about seeing just about anything, that comes through the door. And the only one of the issues I will say, like I have an issue with, is we do have the options for residencies. There's not enough residencies out there, so they're not required in order to practice. We do go through a board certification, so we do have a national test that we have to pass in order to get licensed. And it's expensive. I talking to some of my MD DO, colleagues, I came out of med school with $250,000 worth of student loans. Like it wasn't a, hey, get online and spend $2,000 or $3,000 and get this certification as a natural doctor. Like that's not the case at all. There was some big money dropped here. And then, so when most of us get out, the vast majority of us practice primary care. And that's where I started. I really enjoyed physical medicine, so I did much more of that. So spinal manipulation and, physical rehab, phys med and rehab. But I saw everything. And it's just the last sort of 5 years that I've kind of moved into more of a specialty of endocrinology and board certification and stuff like that. So.
Now, does it vary from state to state? Because like here, I believe in North Carolina, you don't have to actually have a naturopathic degree to call yourself a naturopath, like in a very real sense. Does it vary across states, or how's that work?
It does. Unfortunately, we're licensed in something like 37 or 40 states, something like that. And the licensure does differ from state to state. So I'm licensed in Alaska and Montana. Well, in Alaska, we don't have prescription rights. We can do basically everything else: order labs, interpret labs, imaging, all that kind of stuff, but we don't have any prescriptive rights. Whereas here in Montana, I can prescribe just about everything I need to prescribe and do injection therapies and all that sort of thing. So there is quite a bit of variation from state to state. Unfortunately, you can't just move from one state to the next and do what you want to do. There are states where we're not licensed, and in those states, those people that do get their sort of online certification as a naturopathic doctor or a naturopath, they can call themselves that, and without any sort of legal repercussion for it, which is a bummer. It's unfortunate. I'm like, all right, you paid $2,000 for your degree. I paid $250. Like there's a bit of a difference in our training as well. So that can get really frustrating. Not to invalidate like their knowledge. I'm sure these people like do really well, but it's just, again, it's a huge difference. So we just have to call it how it is.
It's true. That's a really good point. I mean, and I'm sure you get a lot of that, and I appreciate you clearing up like all the work that you did to become a doctor, and that it's a really serious thing. It's a big deal.
Yeah. I mean, I'm paying off these loans for the rest of my life. So it was a big commitment, but at the same time, I went through the progression of, considering conventional medical school and then DO, like osteopathic, because, I read the Andrew Taylor Steele and, the sort of father of osteopathy and this idea of like being holistic, in the way that you pursue health. And it seemed really nice, but really, when it boiled down to it, I didn't want to practice medicine the way it's practiced conventionally, where it's very algorithmic. It's very, hey, we're only going to treat really pathologies like disease. It's not about health. It's about managing conditions and diseases. And for me, that just didn't vibe well with what I wanted to do and the type of people I wanted to work with. And I want people to really be investing in their health and optimize, not just like, hey, we just want to survive here and not have disease, but actually thrive. And there's a big difference between those two. And I feel like I learned, I gained more tools in naturopathic medical school than I would have through a sort of conventional medical school.
Yeah. And I feel like when, the conventional system, and I'm not insulting, by the way, because when you need a doctor or surgeon, you need a doctor or surgeon. Like if you need an MD, you need an internist, whatever. You need them.
Absolutely, 100%. Yep.
So I completely believe that. But we have the knowledge base now as a culture, as a society. We have the knowledge base to know how diseases are caused. We a lot of diseases, not all, but a lot. We know certain factors. Maybe not all the factors, but we know certain factors. And to not take advantage of that knowledge to prevent is criminal, in my opinion. You want to prevent before it gets to that point. And I feel like
Absolutely.
it's too painful. People don't want to discuss it, so they just wait for it to happen to them. And if you haven't had a major stroke, you don't want to wait for that to happen. It's not a good
Yeah,
idea.
absolutely. And I feel like, I don't know if any of you out there follow Peter Attia, but I really like some of his podcasts as well. But he kind of has this phrase of medicine 2.0 and 3.0 and that sort of thing. But it's like, this when modern medicine came about, it was heavily driven by antibiotics and just now that we have antibiotics, like if you have this condition or this disease, this overgrowth, we have this antibiotic that kills this bug, right? And
Yeah.
so it was very logical to be very algorithmic there of if this, then that.
Yeah,
Well,
germ theory. Yeah.
for acute disease, surgeries and acute infections, that makes complete sense. And that's how our modern medical system was sort of devised. Now we're not having the same issues or as much as far as acute conditions like that. It's more chronic stuff, right? Those are the things that are increasing morbidities and mortality. It's the chronic degenerative diseases, diabetes, heart disease, dementia. Those are the vast majority of what's affecting our quality of life and quantity of life. And we're not moving the needle much there because we're trying to apply this acute care disease model to a chronic disease picture, and it's just not working. We have to pivot. We have to adjust to what we're seeing nowadays. And I feel like alternative medicine complementary medicine like acupuncture and naturopathic medicine does a much better job of addressing sort of those core issues and being more preventative minded than sort of our current model. Now, my hope is that we're starting to see a convergence of those two models together so that we figure out what the best balance of those two are. So we get the best of both worlds. And that's what kind of drew me into naturopathic medicine because it's not a us versus them. It's not, hey, we don't do any medications, we don't do any surgical interventions. We only do sort of quote natural things. Like that's not my viewpoint. My viewpoint is what's the best medicine?
Yeah.
What can we start with low interventionally wise and then work our way up and be preventative minded.
Yeah.
And that's what drew me to the medicine because in my mind, I had already created this idea of what I thought health and medicine should kind of be. And then I started looking at these principles of naturopathic medicine and they totally fit, talking about prevention and doing no harm and all that kind of stuff. So
that's awesome. So it's kind of a segue is, I'm sure you get this all the time, but hey, Dr. May, can you help me with blah?
mm-hmm.
Like, oh, I hurt my back, or, oh, I don't know what's going on with this thing on my skin. I mean, I'm sure you hear it all the time. There's a million different things. Can you help me with whatever it is? And I know you have a specialty, but what's your typical answer there? Are there things you can't help people with where it's like, no, I don't touch that?
Yeah. Well, I'd say the list of things that I can't help with are probably shorter than the things I can help with. Just because I think the vast majority come down to lifestyle, right? So it's like people don't eat well, they don't move enough, they don't sleep well, and they're highly stressed. Like if we can modify any of those four, generally it's going to help whatever condition that person has, whatever kind of issue that they may have. Now, occasionally, there's somebody who comes in and says, I've got some major dermatological thing that, something that needs to be removed or whatever. It's like, I'm not going to deal with that. I'm going to refer out. So a big part of being a primary care is just knowing like what you can and can't do and when you need to refer out. And I have no problem whatsoever referring to other providers to do things. I'm not under the illusion that I can fix everything, right? And this needs to be a team approach. And so I love that, we've worked together in a multi-provider clinic, before where we could have somebody come in who, let's say, is overweight, they have chronic pain. Let's say they have metabolic syndrome and they've got sort of poor blood sugar regulation. They can see me for this kind of this overarching, like, hey, let's get you healthy overall. They come to see you for the pain, the chronic pain. And, they get to see a counselor to like work through some stress issues. It's like, we can have that team approach where they get multiple sort of aspects, pushing into that same condition.
I like that.
Yeah. I hope that's where our sort of medical model is moving towards, more of a team approach. Because right now, even though we have specialists, no one talks to each other.
That's true.
If I send a referral to neurology, they do their workup and they may send back, their report. But rarely does anybody ever call up and say, hey, this is what I just saw. This is, what are you doing? Like, can we get on the same page to treat this person? Like, you don't see that unless all those physicians or providers are working in the same office space.
That's true. You don't see it almost ever. And, I hear that question all the time too about conditions. Like, can you treat, and then they'll name off, something, shoulder pain, back pain, migraines, headaches, ED, like, all these different things. And for the most part, the answer is yes. Now, it's varying degrees, of course, and it's varying amounts of treatment, but people forget like both of what we do is an actual system. It's a healthcare system. So that means you can treat it systemically. You can treat a lot of different things. It's not just a niche where you treat like one thing. And there are people who do that. I know a famous acupuncturist in Oregon that only treats eyes, literally just eye problems, best in the country. People fly from all over the country, parts of the world to go see him. He's packed out, just eyes. But for the most part, a lot of general acupuncturists are going to have some specialties, but they can help with a lot of different things. So,
that's what I love about it is you're right. It's a system. So because it's a system, we can apply this to just about anything. I particularly like acupuncture because it's been around for a really long time. And so it's like, you guys have been really good at observation, right? It's like, back way, 2000 years ago, they didn't have the tools that we have now, imaging and blood tests and all that kind of objective data. So they had to be really good at observation and sort of like categorizing things based on those observations. And they've done it well, and they've honed that skill over 2000 years. Right. And so it's like, we have to give that some credit, because nowadays I feel like we've kind of shifted a little, maybe overcorrected a little too much, where we depend a lot more on blood tests and imaging, and we're not very good observers much anymore.
Yeah, no, I would agree. And there's certain conditions that may not show up on a blood test, may not show up significantly on a blood test, but just because of the way blood tests are run. And it's not a bad thing. It's just when you're looking at standard deviations, which we won't get into all that, that's a whole nother episode. But when you're looking at that and you're looking at what's quote unquote normal on a blood test, and it's what I think 95%, like in the middle 95% is normal. Well, if somebody's, at 70%, but they're having symptoms, then it's irrelevant if it shows up clinically, because they're actually having symptoms. So I feel like that's somewhere we excel is, okay, it doesn't say you have high blood sugar, but you're having these symptoms that look like blood sugar, and you're close to it. You're very close.
Yep, absolutely. That's probably the conversation I have the most, because I tend to do a comprehensive amount of blood tests. And I always sort of preface before we go through those blood tests with patients that, hey, I'm looking through a slightly different lens than what we would normally look through pertaining to reference ranges and values, in that I want to see what's sort of optimal. And then we want to look back, take a step back and look at it all together as a big picture and see if we're seeing certain trends, things that sort of developing, that we can sort of back into that prevention mind, right? Of like, hey, these are some things that look like they're starting to move the wrong direction. And let's start addressing these things before they become an actual condition or disease or
Yeah.
whatever we want to, give it a name, based on a certain value, right? Some of this is somewhat arbitrary, really. It's just been done a certain way for years. Like you look at hypothyroidism, the reference range for that is abysmal. Like we know, like if you're running about a 4, which is still technically normal, and your T4 levels are down there at the bottom, like you're probably experiencing some symptoms of hypothyroidism. It's like that should be something to be looked at, evaluated, and come up with a treatment strategy and some proactive tips to try to change that before it gets out of hand.
Absolutely. And I think that's important. And also spotting things that maybe the primary care, their MD may not have time to spot. I've done that quite a few times. I had a patient that was showing a lot of symptoms and was just diagnosed with a nerve issue and told to go on their way. But they were having balance issues. They said they didn't have double vision, but they were having some eye problems. And I'm like, you really need to talk to a neurologist, and I had some different things running through my head. This could be MS. This could be, it could be trigeminal neuralgia, but then that wouldn't explain the balance issues, which is what they were saying is like, oh, it's just a nerve issue. And it ended up that they were able to go and find out a lot more information and actually get a diagnosis that they wouldn't have gotten before because they would have never been allowed to go down that road just because the doctor didn't have time. And it wasn't mean. It's just the doctor didn't have time to
Sure,
listen for half an hour
sure.
for them to, slowly tell all their symptoms.
Yeah. Well, you're right. It's a management system, right? So it's all right, we're going to track these things until you're in a position where we have numbers that indicate this is a disease or what we want to call it a disease. Once it hits that, then we'll start treating it and managing it. But it's generally mostly just about managing numbers and symptoms, and that's it. There's not really this push to see, like, try to get into the root cause, try to reverse whatever issue that there might be, because that takes time. It's not something that a 7 to 15 minute visit is going to fix.
It's true.
That's the part of the problem of our system. The way it's kind of created is it's just about managing those symptoms and managing people, not so much about curative response, which is, like I said, it takes a lot longer to do.
Yep. And it
But
becomes
anyway,
really important because we're going to segue into COVID in a minute. But during the COVID pandemic, a lot of people stopped going to their doctors. Some doctors got closed down. They weren't able to see as many people. And then all of a sudden, you're missing out on stuff like cancer screenings and like basic blood work that would start to show diseases before they got to a really bad point. And now I've noticed a lot more. It's like, okay, we're seeing some more cancers. We're seeing some more stuff, which I figured 2 years ago. I predicted 2 years ago this was going to happen because people weren't able to get the screenings that they were supposed to be getting. And if natural clinics got shut down, then that's another avenue where those red flags were getting missed.
yeah, totally agree.
COVID changed everything.
Yeah, it did. It did. But I think a silver lining for the whole COVID mess was one, all of us understood that we are vastly unprepared for the next pandemic and
Yeah.
how we figure this thing out, both from a public health standpoint, from an economic standpoint. Like, how do we navigate something like this where we're trying to protect people, but at the same time, people are still able to live and to provide income for their family and all that. Like, that's a tricky thing. Like, I would not want to be, a politician or someone trying to make those decisions, because those are very hard, tough decisions. But at least I think we've all kind of figured, all right, we didn't do that very well. I think we need to figure out how to do that better, because this won't be the last pandemic that we even see in our lifetime. There's going to be another one. I guarantee it.
Yeah. And can you imagine something with a 20% kill rate? Like, it would just be,
I mean,
crazy.
Yeah, think about Ebola. Ebola had a 40%, right? Think about something like with the mortality rate of Ebola, but the spread rate of COVID. Like, that would wipe out, it'd be the Black Plague again. It would wipe out a quarter to half of the world's population in no time. So this has to be a priority. We have to figure out how to do this better.
I agree. I agree. And speaking of COVID, have you seen a lot of, post-COVID, have you seen COVID affect people's lives kind of in the long term after the pandemic? They've had COVID once or twice.
Yep. Yeah, absolutely. This is a weekly conversation that comes up. It's part of my regular screening now. Questions with their intake, asking them like, "Hey, did you have COVID? Did you get the vaccine? How many vaccines? How many times did you have COVID? What were the symptoms? What are your current symptoms?" Like all of that stuff is becoming just a regular thing now. I'll tell you, like just in the endocrinology space, because I do a good amount of like fertility, hormone regulation type stuff. I've seen some pretty big consequences from that too. I mean, sperm counts that are zero now. Yeah,
Really?
much higher
Wow.
level of infertility. Which I mean, we would expect. We see sometimes with viral infections, we'll see a short term drop in sperm count, and usually it'll bump right back up in 3 to 6 months. But we're seeing some prolonged levels or kind of decreased levels for much longer than we would have anticipated. After a major infection like that, we see it. I haven't seen it myself, but I have been to conferences where other providers have made note of the vaccine doing the same thing,
Yep.
obviously in smaller amounts. So I think that's a big kind of misperception too. Like people are like, "Hey, I got the vaccine, I got super sick, and I had all these issues." Well, part of that we would expect. The vaccine is meant to create an immune response, right, to protect you from the virus. So we would expect some of the similar consequences of having COVID, just at a much lower rate. It's called relative risk, right?
Yeah.
So not that these numbers are correct, but let's just throw some out there. Like if you got COVID and you had a 90% chance of developing chronic fatigue after that, getting the vaccine gives you a 10% risk. Actually, it's probably much, much less than that. More
like a lot less, 1%.
1 to 3% kind of thing. But so there's still risk there, but the relative risk is much lower than if you were to actually get the infection. So I think there's some misperceptions there, some bad education on our parts as health providers and public health.
Well, yeah, the government dropped the ball, and they did their best, but they dropped the ball because they really wanted people to get the shots. And so when they pushed that, they made sure to downplay anything negative and upgrade anything that's positive. Yep. And the problem is that it comes across as a lie, because it kind of is a lie, because people are like, well, now we're having these side effects. I've had patients who have gone into menopause who were already right on the edge of perimenopause. And then the vaccine pushed them over the edge, kind of like COVID probably would have in the same exact instance. Yep. And it probably wouldn't have anyone. They were for everyone, but they were already on that edge, and it was enough to push them over. And it just wasn't educated particularly well.
Absolutely. I totally agree. Like, I think there should have been full disclosure of like, hey, this is exactly what we've seen happen. And these are the conversation I have with every single patient that I have come through here is risk versus benefit. Obviously, we want to do more things that provide more benefit with the least amount of risk, but there's rarely anything that ever has zero risk, right? And that's what should have been discussed with COVID is, hey, here are the potential risks, and these are their percentages. And we knew that information. It wasn't well put out into the public, so that everybody was aware and educated to it. And obviously it became politicized and all this kind of stuff too.
And that's what I got.
Yeah. And that was interesting. And traveling around the country during a pandemic and seeing how each state, addressed COVID. And I mean, it was clearly politically driven. If you were in a red state, it was vastly different than if you were in a blue state. And that shouldn't be the case. Science is science. It's like that information shouldn't be politicized, and it was. And so again, we just have to figure out how to do this better. And I'm not a believer of mandates. I don't think that the government should mandate anything. I think we
Preach.
should educate people.
Preach.
Yeah, we educate people to make the right decisions, right? But this
Yeah.
is
No, I
America.
agree.
We shouldn't
I agree
shouldn't
completely.
force anybody to do anything.
Truth.
Right?
Absolutely. And what you said is dead on. I think also for the future, we really have to look at making sure that the trials are set up correctly. Because if you look at it, a lot of the issues with menses that are coming up, there was no questions in the original trial for like women's health stuff. They didn't ask
Yeah.
anything about menstruation, anything at all, because it was probably designed by a bunch of old white dudes who didn't think that was actually important to ask. I mean, it's crazy. Like,
Well, that's part of like the how fast it came on and trying to figure out solutions quickly, right?
no, I agree.
It's
I
like,
agree.
you just do what you know how to do. And they were trying to do it as expeditiously as possible, right? So, again, I think the silver lining here is that we're learning how to do things better. I will tell you, too, that just from sort of research perspective, this is in my lifetime, this is the first time since I've been in medicine and looking at research, and somebody who is heavily invested in trying to figure out, like, looking at research in various aspects of health and following that. This was the first time in my career that I saw such a sort of joined attempt to share information and share data. It became less about us versus them and this country having better research than this country. And it was more about consolidating that information and sharing information and opening up those lines of communication, which is extremely encouraging to me to be able to do something like that and share instantly. Some lab in Germany that just came out with something, we know like instantly, like the results of a trial or whatever. And so that was promising to see. I hope that continues. I think that's going to be a good step in the right direction, at least.
And I love what you said though about like risk versus reward. That's exactly how I went about it too. Is like, you look at the risk profile and then people make an independent decision based on how they feel and the way things should go. I think that's the better way to go. If you have the right education, I think it's great because it's, people have the freedom to choose what they want to choose. I think it's smart. It's a good thing, especially in America. And people listening all over the world, we're not insulting your country at all.
Yeah,
but
that's
America.
Right. No, that's right. Well, I mean, this is our home. So, it's just like we're trying to figure out how to do things better here. And that should be the point, right? It's like, I don't care if you're Republican, Democrat, what religion you're in, like, hey, we're all in this together. We have to figure out how to make this work. Because like I said, that this is not going to be the last time we see it, even in our lifetime. Anyway, have you seen anything COVID related that has been kind of consistent?
I've seen so many post-COVID cases of, extreme fatigue, changes in menstruation. It's aged a lot of people really badly. And when I say fatigue, I'm not talking about like, I feel tired in the morning. I'm talking about debilitating, can't function, can't do your normal life type of tiredness. So, which makes sense because in Chinese medicine, it's called latent heat. And basically it's like heat that gets locked into the body. And you can think of it as like an ongoing inflammatory process that just doesn't stop. Mm-hmm. And but from this perspective.
Gotcha. What about neuropathies or any sort of nerve related? I've seen seems to be an uptick in that as well.
Yep. Seen a lot of neuropathies coming in. I've seen a lot of, ongoing pains of all types after COVID, where it's like even tendonitis and like other inflammatory things that just kind of pop up. And it's really hard to tell, this in your medicine. It's really hard to tell like causation versus correlation because we're on such a small scale. But I know what I'm seeing, and what I'm seeing is like, okay, I'm seeing an uptick in these things. But sometimes it's hard to step back and say, okay, is this just because I'm seeing a lot of this, or is this because of COVID or because of the vaccine or because of whatever?
Yeah, I know. I have to be careful myself too with that. it's easy just to kind of get stuck in your own sort of part of the cosmos and like of what you're seeing and trying to jump to, causations, correlations like that because of just what you've seen. Um,
Yeah.
yeah, that's a hard one not to do because it's your experience. So obviously you want to try to make sense of that experience. But then trying to jump into making major generalizations kind of get tricky.
Speaking of, I'm sure you can speak to this, but people really need to be careful. Everybody listening, be really careful what your sources are for whenever you have some kind of information and you're like, I saw this online and
Mhm.
it says, and then something really wacky off the wall that no one else agrees on except for this one person. Like,
Mhm.
be really, really careful and make sure you're looking at multiple sources. You're looking at, okay, who said this? Are they an expert? Are multiple experts saying the same thing? That sort of thing, just to make sure that your information on whatever you're looking at, whatever health condition you're looking at, is solid information and not just going to scare you.
Yeah. Yeah. Right. No, yeah, I'm with you there, man. I mean, I don't know if it's just our profession or what, but I feel like I have a lot more of those conspiracy theory conversations than the average health provider. I don't know. Maybe I don't,
Oh,
but
don't want to get into this, man.
but yeah, I mean, you're right. Like, if you're getting information that seems incredibly, inconsistent with the rest of the information, I mean, your first thought should be, is this really accurate? Or why does this person know this information when all these other sources don't? What's the likelihood that they actually have it right? They absolutely might, but yeah, that was a hard conversation to have.
And even when there are leaks, it's like there's usually leaks from multiple sources.
Hmm.
Even if it's like, somebody's hiding something and then it comes out, it's like there's usually at least multiple sources that are showing like, oh, well, it came out here and it came out here. It's rarely just one person telling you that the earth is flat. Like, oh, well, they have proof
Hmm.
on YouTube. I'm not going to get
Right.
into that. That's a terrible thing to get into. But I am
Oh
saying, like,
gosh. Yeah.
not telling you what to think, people, but I am telling you to think. Not
Yeah.
telling you what to
Absolutely.
think, but think.
Yep. Yeah. Think critically. Get lots of other sources of opinions. This sort of, I feel like during the sort of COVID experience, this sort of cognitive dissonance became like a really significant theme. This
Mhm.
getting away from that sort of critical thinking or looking or sort of validating sources and just kind of,
On all
the
sides.
yeah, and the cognitive biases that comes with it too of, hey, this is how I think, so I'm going to gain more information that validates what I initially think and just reinforce the bias that I have and not really pushing into our own biases. Because we
Yeah.
all have it, right? We have it based on our conditions in our lives, like where we're from, what region we're at, what kind of things, information we're exposed to. Obviously, yeah, we all have biases. I think a big part of that is realizing what are our biases and then kind of pushing into that because we may not be right or we may have the wrong perspective. And
No, absolutely.
yeah, being able to have a conversation with somebody that has a differing opinion, is so valid and helpful. But I feel like we've kind of gotten away from the ability to be able to do that very well.
I actually talked to a friend earlier today that he and I differed on something major, and we had like a heated discussion, but it wasn't a fight. And then at the end, we both came out understanding each other better. And we're like,
Mhm.
okay, we understand each other better. We're still friends.
Yeah.
And like, turns out he kind of misunderstood my position a little bit, and I misunderstood his. And I think that's something
Mhm.
we can learn from all of this. I think whatever side of the spectrum you're on, if you're listening and you're like, the vaccines are pure evil and they've killed everyone, or if you're listening and like the vaccines are pure good and they should be mandated for everybody from like
Mhm.
1 week old to age, whatever, like still being
Right.
able to talk to each other
Yeah.
and be able to see from each other's perspective, do your own research, and still be able to be humans together. I think that's
Mhm.
essential.
Absolutely. I couldn't agree with you more, man. Yeah.
Yeah. And I think that you were talking about learning for the next pandemic. That's something I hope we've learned is
Mhm.
that like looking forward. Like, we're in this together. You said that. I agree. And, objectively looking at information and then deciding on something, that's best for you and your family while not, crapping on someone else's opinion.
Yeah, just being able to have rational discourse, right? Like just
Yeah.
talking through issues, which I mean, I've had to learn how to do better too. Like I'm not sitting here on my soapbox and just kind of looking down at people because I've struggled with this myself. I use sarcasm a lot as a
Wait, really?
strategy.
Sorry.
Yeah, that's
No.
good. No, really? No. And sarcasm is not great for having rational discourse. It puts people on offensive.
That's a good point.
Yeah. So yeah, it's like learning how to just talk with people better in a respectful way where you can, and I feel when you do that, like coming at somebody to understand their perspective and not to argue against their perspective is something I don't think most of us do very well, myself included, especially.
Yeah, people come in with an agenda of like, I already know what I think, and now they're going to say something, and I have to be ready to rebut what they're going to say.
Mm-hmm. Yeah.
Like, that's the entry point. Instead of saying
Right.
like, how about I'm open to what they have to say, think it
Yeah.
through, discuss it with them, and then like see where it
Yeah.
goes.
Yeah. I almost want to start the conversation with, is anything that I say going to change your mind? Not that that's the point. I don't want to necessarily change your mind, but would anything actually change your mind? If nothing will change your mind, why are we having this conversation in the first place? Because you're just trying to win an argument, not actually
Yeah.
try to understand or actually seek what the truth is. Because if you really want to seek truth, you have to be open-minded to a lot of different ideas and perspectives, because yours may be wrong. Actually, it's probably very likely yours is wrong. So
Actually, it's likely yours is wrong, Ash. No,
I'll
I mean,
admit, yes, that probably is.
no, I think we're a good example though. Like, you and I are a great example. Like, we're friends, we talk, like, and we differ on plenty of things. We've had great discussions on things we differ on, and it hasn't affected our friendship whatsoever because we're both intelligent adults who can have a conversation and actually listen to the other party. And I think everyone here can do that. Like, this isn't something that just a couple people should do. I think everyone should do it. There should be that healthy discourse of, instead of just saying, well, they're crazy. Like, obviously they're crazy because they don't think like I do. It's like, no, I actually get to know why they think what they do.
Yeah. Yeah. I mean, that's just, if we validate and respect people in any sense, then I think we all owe it to each other to be able to do that.
Yeah. I love where this conversation went. I was not expecting that. That's great.
I was not either. That's great. Oh, I love
start
it.
singing Kumbaya now.
All right, man. Anything else you can think of? Any other trends or questions that people have kind of brought up recently?
Not really. I have a short one. Does it hurt? The answer is usually not, because the needles are really tiny and I'm good at what I'm doing. But
I have to say, I've had a lot of acupuncture over the years, and I still like your technique the best. That little thump that you do.
Man, thank you.
Yeah, it really is extremely effective and doesn't hurt at all. Like, I've had some acupuncture where they go in really slowly and they start turning. I'm just like, oh, that's rough. But I never had that experience with you. So
yeah, thank you. Never go to a timid acupuncturist. If they're timid and shaking, just walk away.
Oh yeah, no, you have a confidence about you too. Like, there's no playing around. It's like boom, 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 you're done. Like you said, you can tell like you're very confident in what you're doing, and you have a really good technique about it.
Thanks.
Which just helps, kind of soothe any sort of hesitancy or issues that the patients might have.
Well, thank you. I appreciate it. But yeah, those are my main questions. How about you? Before we wrap up, any other questions that you get asked regularly? Or
no, I mean, just other than with COVID, like you were saying, like with the perimenopause, menopause, kind of pushing people into that, maybe a little bit faster, expeditiously. Like I've seen that too. I've seen testosterone levels really tank in guys who, were pretty stable prior to COVID. like more infertility, like I was talking about previously. So, it's one of those things, like if you're out there and you're listening to this and, you're maybe over the age of 30 and you've had COVID once or twice and you have fatigue and you're not feeling yourself, and get your hormones checked. Just get them checked and see what they're looking like. If like I saw this just this week, mid 30s, 35-year-old guy, some fatigue. He had COVID twice. We measured his testosterone levels and they were at 300. Technically, he was still normal, but at the rock bottom of the range. Definitely not optimal for a guy his age, And so it's like, well, I mean, we didn't know what it was prior to COVID because he was a new patient, but still, that's pretty low for his age. So that's an area that we're trying to work on to improve.
Yeah, that makes sense. And any illness can change things. So it's important, post any major illness to look at your numbers, see, are they going to recover? Does your health come back to where you want it to be?
Yeah, absolutely.
Man, this was a great show. I was not expecting the direction of the conversation, but it was terrific. So
yeah, I'm kind of looking forward to throwing these shows in, these kind of AMAs out there. So if you're out there, if you have questions or just things about just how Mike and I practice, or just kind of random things, you have questions that pop up, send them to us, and we're happy to throw in these AMAs every now and then just to address those kind of questions and kind of get off topic for a little bit.
Yeah. And it's drunkenmetazen with a Z at gmail.com.
There you go. That works. All right, man. Anything else on your side?
Nope. I'll put down the way to get a hold of us, that email, in the description as well, just so y'all have it. And we love to answer questions, so don't hesitate at all.
Okay. Awesome. All right, guys. Till next week. We'll see you then. Take care.
Peace.
Be healthy.